Hey y'all, I'm Amy Morgan with Pediatric Dental Associates in Orthodontics, and welcome to PDAO Team Talk. Today's special guest is Dr. Garrett Sanders. Go ahead and say hello.
Hello, how's everybody?
I think we're all doing well, but
Good.
We'll see, right? Okay, so Dr. Garrett, tell us a little bit about yourself, and then we're going to get into all the dentistry stuff and everything, but just tell the audience a little bit about you and your family and growing up in Northwest Arkansas, I guess.
Yeah, so I'm from Rogers originally. Families from the area going way back, so we're originals. Went to Rogers High School, graduated from the U of A, met my wife Rachel at the U of A. We've been married 15 years this month. We have two little boys, 7 and 5. After the U of A, I went to dental school at the University of Tennessee, and then decided to do a residency in pediatrics at the University of Cincinnati Children's Hospital.
I've actually had the chance to work with your wife, Rachel, because your wife actually worked for us before y'all left for dental school. So that's super cool.
She did, yeah. So whenever I was at the U of A, she was Dr. Jerry's assistant, and I actually got to go to a Christmas party at his house and met a lot of them, and I think they remembered. So whenever we were trying to decide where we wanted to go, when I was finishing residency, she still had some of their phone numbers, and she kind of reached out on my behalf. And then, yeah.
And then here we are. Now you're my boss. Wow. Okay.
Yep.
So, yeah, exactly. So as far as dentistry goes, has this always been something you wanted to do, or did this kind of come up while you were in college, or what kind of got you into dentistry?
Yeah. So no one in my family had actually gone to college. And so I didn't have really like a foundation of expectation necessarily about, what I wanted to do really. And so in high school, I really enjoyed science and medicine. And so I kind of went into my college experience thinking that I would do something along those lines, but I didn't have like a specific interest per se. So I actually started out thinking I might go to pharmacy school, and I was a chemistry major, and I kind of shadowed some pharmacies, and I was interested in that. But then I met Rachel, and Rachel was actually doing dental assisting, and she said, hey, I think, this is something you might think is interesting. And I had started to question whether pharmacy was right for me anyway. And so the office that she was working for, so it wasn't us, but it was a general dentist in town, they were kind enough to let me come shadow. And I spent quite a bit of time there actually when I would not be in class, and I got to see a lot. And then I got a job working for Ozark Oral Surgery in Rogers, and I spent a lot of time working with them. And after kind of being exposed to it, I felt like it checked a lot of the boxes for what I thought that I wanted out of a career. And after, a lot of thought about it, by my junior year, I would say at the U of A, I was pretty committed that that's what I wanted to do. And I'm glad that I did. I think it was a good fit.
That's awesome. That's awesome. So now you're in dental school.
Mm-hmm.
Getting into dental school is very hard, by the way. And Arkansas at this moment does not have a dental school.
I think we're getting one.
And we are getting one, right? But so most kids that are in Arkansas there's some kind of grant or something that Arkansas has deals with other state institutions. So you're able to go to other dental schools as an Arkansas state resident, and they work with them. So I think that's pretty cool, because a lot of our dentists that work at PDAO actually have went to the University of Tennessee. There is a pediatric residency there, but Dr. Garrett did his pediatric residency in Cincinnati. So I know in dental school, everybody goes through kind of the same classes. And then there's this moment in time where you have to figure out, are you going to go to general? Are you going to go on to do peds? Are you going to go on to do ortho? Like kind of, but what had you go into pediatrics?
Yeah. When I first started, first off, I think that it's for anybody that is watching this and thinks they might want to go to dental school or have a kid that wants to go to dental school. I think it's important to go into dental school with the mindset that you would be content being a general dentist. Because if there's no guarantee that you're going to be able to specialize. And if you go into it and you think that you find general dentistry to be like not a good fit for you, then you kind of set yourself up a little bit. So I went into it fully prepared to be a general dentist.
Okay.
But I was interested in several of the different specialties. I had worked for an oral surgeon. Rachel had worked in pediatric offices for a long. She worked for us, and then when we moved to Memphis, she worked for an office in Germantown for a good portion of the time that we were there. So I had a lot of exposure to pediatrics, but other specialties too. And I think maybe by my second year, between my second and third year of dental school, I, had gotten to do enough stuff that I think I had a pretty good idea of what I liked and what I didn't like. For me, the thing that I like the most about pediatrics, I like kids. I love working with kids. That's obviously great. But, a misconception about pediatric dentistry is that it's like getting to hang out and fun with kids, but it's a lot of it's hard. The kids don't necessarily want to see you, and sometimes it's difficult. And so though it's fun and loving kids and liking interacting with kids is important to do this job, it's not all fun all the time. And so I think for me, where I saw the reward of this particular specialty is I like the idea of disease control and pain relief and education and prevention. And not that other specialties of dentistry don't deal with those things. This specialty in particular really lends itself towards the prevention of disease, the elimination of disease, and the foundation of habits. And I feel like it's a very hopeful specialty, whereas some of the other specialties of dentistry are more damage control. And if you're an oral surgeon, you see a lot of really damaged teeth, and you are sort of the end stop for that. Or if you're an endodontist, every tooth you see is damaged, and you're not involved in preventing disease. And so for me, I liked the technical aspect of those things, but I love the idea that in pediatrics, maybe you could keep it from getting to that point. And a lot of the folks that I saw in dental school, the adults that I saw, kind of a recurrent theme, I would say, is that one of the reasons why they had an oral disease history or an issue was that they didn't have a foundation. They didn't have an education in oral hygiene or dietary practices. Maybe they had a negative experience as a child that jaded their view on dentistry going forward, that kept them from wanting to seek adult care. Maybe it wasn't valued in the home. Who knows? But you would see that there had been neglect, and that neglect could have been avoided if things had been intercepted early. And so I was very intrigued by that and the ability to maybe like eliminate some of that in the world. And now that I'm in this specialty, I see that actively, and I can see it come to fruition. And so I feel like it was a right fit.
Yeah, so. I think that's awesome. I think these are things that I have never heard Dr. Garrett say. So I think that's very eye-opening to think about the different specialties and the prevention and all of that. And I know, especially for us here at PDAO, that education and prevention is a huge part of what we do. You have been a really strong person for me to go to and ask, like, hey, we want to talk about this. What point should we hit? That kind of thing, which leads me into, you and I have kind of already talked about this, but I know that you have like kind of a top 3 things that you kind of really want parents to know. And I know the first one is about their diet. We've talked about this a lot, especially on our channel, and we do a lot of social media posts about this, but go a little bit into that about why diet is so important and why it's so fundamental for prevention.
Yeah. So, stealing something from point number 3 that we'll get to in a little bit. But one thing that we'll get into with that applies here is just that, first off, I think a lot of this feels alien to people, and it feels a lot more complicated than it really is. And that applies maybe first and foremost with the diet concept. And I think for a lot of people, it feels like maybe tooth decay is unavoidable, or they feel like they are genetically hopeless. All of their family struggles with decay or whatever. And diet is kind of an enigma in this country, in that we have, for a lot of folks, not everyone, food insecurity is very real, but for a lot of folks, you have sort of unlimited choice of what you can eat. And a lot of people don't really pay attention to things that are sort of innocuous to them. Like it's little things like a graham cracker or a fruit gummy, or some kind of carbohydrate snack that at face value, it's not a Snickers bar or whatever. And so, they don't think about the context of those things. And whenever you start talking about diet, people get overwhelmed because they feel like, I can't get my kid to eat. They're picky. And, you're asking me to make drastic changes, but it's not and that's the thing. It's not drastic. It doesn't have to be hard. It doesn't have to be alien. It doesn't have to be this foreign, like impossible thing. What people need to understand about diet is that there are like two fundamental things that you have to know. One is that it's all about carbohydrate and sugar. And two, it's about frequency of carbohydrate and sugar. And so my kids eat Cheez-Its. My kids eat gummies on occasion. My kids will eat a jelly bean. But it's about the context that they eat those things. And so I think people will start to bristle sometimes or tune you out when you start to talk about diet because the concept of modifying the diet of a child can be overwhelming when a lot of people do struggle to get their kids to eat. And B, they start to feel attacked a little bit, like you're telling me that I'm not making good choices. But here's the thing, like you don't know what you don't know. And so if no one's ever told you, hey, high frequency carbohydrates is bad for your kid's teeth, it's not that you explicitly did something wrong. You acted with good intentions. You just inadvertently did something that maybe made your kid at a higher risk to have a adverse dental outcome. And so I think if people would just, like, if you objectively look at your kid's diet and you go, okay, what could we change? I'm not saying go in your pantry and throw all of your carbohydrate snacks away. I'm not saying, never, to be completely over the top restrictive. What I'm saying is if your child is a high frequency snacker, cut out one or two snack events. Sub one snack event for something that's more protein, dairy, if your child doesn't have an allergy, obviously, vegetable, whole fruit based. Little changes. Start small. Start introducing your child to more whole foods when you have the ability to do so. Being careful about giving the refined processed carbohydrate snacks as a standalone. Like you could have your kid eat some goldfish crackers and look in their mouth and you'll see immediately the illustration of what I'm talking about because they will stay orange packed in the grooves for an hour after they eat them. And the whole time that's in there, the bacteria that cause decay are metabolized. They're eating that stuff. They're eating the goldfish that's in your kid's teeth. So just little changes. Liquid, sugar. So try to do more water. But I'm not saying they can't have other stuff. If you go out to eat, you want to let your kid have a soda, let them have a soda. I don't care. Like this isn't like a judgment thing. My kids will have lemonade or something if we go to Chick-fil-A or whatever. It's about when can we substitute these things and make little choices that build towards a better overall health picture for the kid. And if you start with little changes, then you eventually will build you will reconfigure the lifestyle. And I think a lot of people, they leave and they think, this is not possible. So they don't try, or they're mad or they're irritated with us for trying to blow things up. But I'm not saying cold turkey it. Pick something, small change, baby step. And before you know it, you can make an impact dietary.
Yeah, I think that's awesome. I think that's a good gauge too, to just kind of give them, something to start with. Like, let's just take one thing. I know when I talk about it all the time, a lot of parents will, they'll comment or they'll say things like, but my kid loves milk. And my kid, we're not saying don't have milk. We're just saying like milk's not something that they need to walk around with. And like, if they have it at dinner time, that's fine. But like, you don't want them walking around with a sippy cup full of milk all day. They're just constantly introducing sugar. So it's kind of that same thing with the snacks as well. And I think those are really good things for parents to start out and try. So the next thing that we've talked about is hygiene. So let's talk about that from a prevention standpoint. Kind of, parents are always telling us, but it's so hard to get them to brush.
Yeah. So I think just like diet, I think hygiene is another one of those things that maybe people have an illusion that it has to be a lot more elaborate than it has to be. And it doesn't. And I think that's kind of the overall theme here, is that little things make a big difference. And so, if you have a young child, say a year old, you're not spending 5 minutes brushing, flossing, rinsing, you're not doing those things. You can, I mean, on a kid that's got, just incisors and maybe a couple more teeth, it's a year old, 18 months old, you can brush that in 20 seconds if you're thorough and you're visualizing what you're doing, and you do a fine job. And as they get older, you're building to a minute, you're building to 2 minutes, like you're working towards this, but you can knock it out pretty fast. And, I think a lot of people, they set themselves up for failure a little bit, and they expect too much of themselves. Like, you can't expect a child, I would say, under the age of 3, there are kids that will allow this to happen. But I don't think it's reasonable to put pressure on yourself as a parent that a child under the age of 3 is going to stand there and let you spend 2 minutes thoroughly brushing their teeth, standing really clear visual field. And so instead of getting frustrated and giving up, what I would tell people is to just modify your environment. And this is so much of like parenting anyway, but you're going to find yourself in situations with your kid where you can, sometimes you got to stand firm in the battle, but other times, like, is it worth the battle? Or can you modify the environment to yield an outcome that's satisfactory and is less stressful for everyone? And so if your kid won't stand still and you can't access their teeth and you don't feel like you can see, lay them down. Lay them on the couch, lay them on the floor, lay them on their bed. Get them back where they're open and you can visualize it from above, just like they do like we do at the office. There's a reason we have them lay down. That's when you can see. Lay them down. If your hands are clean, kind of elevate their lip up so you can see, because especially on the little bitties, if they're going to eat a cavity, it's up here. So if you can elevate it, you can get the gum line along those upper teeth. And you can't see that if they're standing up or if they're alligator rolling or whatever. And so, just change the posture. Get an electric brush, a cheapie, $5 or whatever. They don't have to be fancy. And then an electric brush can allow you to emphasize placement over technique, because a lot of people, you're going to get one or the other. Like, I got the brush on the tooth, but it was sort of just like straight and haphazard, or I got the little motions, but it's like on every other tooth, or it's up on the gums, or who knows. So if you get yourself a little cheapy electric brush or a nice one or whatever you want to do, you can focus on, I can hold the brush where it needs to be. I can navigate the teeth and the brush is working for me. And then wham, like, you got a good brush in and you didn't spend that much time. Little things, again, that modify the environment of your oral hygiene experience with your kids can allow you to do a much better job. And it doesn't have to be a huge investment in time, money, or energy, really, But I mean, as far as like practically, like, what does that look like? You want to brush your kids' teeth twice a day if they're under the age of 5, I would say. And it depends on the kid, but for sure, under 5, assisted brushing, I think, is important. Over 5, it depends on the child. Some kids still need help, some don't. But I think visually supervised brushing after 5 so that you see them do it and that they're doing it. And then it's up to parental discretion. If you've been kind of peeking in and you're watching, they're doing it good, then fine, let them do it, But making sure it's getting done twice a day. Flossing the teeth that touch. I would say in general, you want to be nailing brushing 100% before you mess with floss. If your kid's burning out when you're brushing their teeth and you're not getting it done well, don't try to force adding floss into a system that's already not working very well. But if you're crushing the brushing and it's doing really well and you feel like you're getting it done, you want to add flossing and they have teeth that touch, go for it. And then, later you can implement mouthwashes and things like that. I think we recommend fluoride toothpaste just to smear at any age, pretty much, 1 on. Pea size, 3 and up. And then, they get into elementary, you can kind of just go from there. But, as a general rule, you can always use less than you think you need. You don't need that much toothpaste to be effective. A lot of people, they have the kids drink water right after they brush. I think, to me, if you have a kid that's high risk, your kid has had, a cavity history, I think there's value in having them brush, spit excess, and then go to bed. Don't rinse it out. Fluoride requires contact time with the teeth to be effective. So if you brush with fluoride and you immediately drink water or rinse your mouth out with water, then you've kind of killed the opportunity for the fluoride to do what it's supposed to do, which is to have a chemical exchange with the tooth surface. And so I think that's kind of a misconception. But yeah, I mean, not a lot of things. It's not a long list. It's just trying to find a way that you can execute it in a way that's not driving you nuts. Your kid is enjoying it. You're not creating a negative connotation with the experience, and you're getting it done.
Yeah, I think that's really good advice. I know you said that, visually watch them, and I still check my 15-year-old.
Mm.
So just so you know, and so far he has been cavity free. Yay. Okay. So lastly, we just kind of talked about, kind of the parents' conception and maybe even misconceptions of what, a dental experience might look like, and then kind of how us as an office, what we do so that to alleviate some of that stress for them.
Sure. So I think, there are a lot of cultural stigmas associated with the dentistry, but even within that, I think that there are a lot of individual stigmas about pediatric dentistry. And I think that there are a lot of biases that parents hold from their experiences that are projected onto the kids. And so, I think if you polled a lot of people, and you ask them, like, what are some of your like top 5 like fears? I think for a lot of people, dentistry would be on that list. And that could be because of, associative misunderstanding, things they've seen in media or that they've heard from other people, and maybe they haven't experienced it, but it's ingrained. Some of them may have had a terrible experience because dentists are humans, and some of them, they make mistakes, and so maybe somebody had a hard time and now they're scared or whatever. And so I'm not discounting those things, but I think that by and large, there are a lot of really positive dental interactions. And I think that a lot of the negative, it gets a disproportionate amount of the time, the press or the attention. And then for this specialty specifically, if a parent has a negative dental connotation, they will project that onto the child. So if parents had a bad experience, their anxiety is high. There are a lot of studies that show that parental anxiety projects really profoundly, and parents that have had bad dental experiences, their kids have bad dental experiences at a higher rate because the kids perceive that tension, just like the kid will perceive the tension from the provider if the provider is not confident or if the provider's anxious or whatever. They will also perceive that from the parent. And so, I think that's one aspect that I think is important for parents to know is like, hey, I understand that you may have had a terrible dental experience, but we are 100% out to change that for your child. And I can't change that for you, but I can change that for your child. But for us to have the opportunity to change that for your child, we have to have a clean tablet to work with. And if your child comes in with a already conflicted idea of what the experience is going to be, then we are working uphill. And a lot of times the margin for things going well and going poorly is fine. And so you want to have stacked the deck in your favor as much as you can. So build it up, make it positive, encourage your child that they can do it, that they can cope, that they are going to be able to handle it, that it's going to be good. And that matters. It really does. Another thing, like from a stigma standpoint, that's not associated to like negativity necessarily, is I think a lot of people think that baby teeth aren't important, and I hear, I'm not going to say I hear it daily, but I hear it often. People will say, well, they're just baby teeth. But I think when I look back, I don't remember when I lost my last baby tooth. And I think a lot of people don't. I think people forget just how long you keep them. I think even though you lose your last one, potentially as a teenager, it's just like it eludes you. And I think, the assumption is, well, teeth start falling out at like 5 and then we're done. But, a lot of kids, boys especially, they still have baby teeth at 13, 14 years old. And so, you think about if they get those teeth at 6, from 6 to 12, 13, 14 years, it's a long time. And a lot of your child's health and function depends upon a complete oral environment. And so if they're having decay, they're losing teeth, then their chewing is compromised, their speech is compromised, their like diet will be modified. They'll be in oral pain. It will compromise their ability to pay attention at school. It's going to affect their sleep. It's going to create anxiety, and they will be more negatively primed for their dental experience because their mouth already hurts. Like the more treatment appointments they have to have, the more negatively they'll view it. Like there's all these things. And so what I would say to that is like, yes, they are baby teeth, and yes, they'll fall out, but they play a very critical component in your child's development. And if we allow them to be diseased unchecked, it is the negative effect on your child's kind of health and happiness is significant. And so it's not just us wanting to find something to do. It's not us just wanting to find something to fix. And we're very objective. I feel like if your kid's 10 years old, their tooth's going to fall out in a year and they have a little bitty cavity, we're not going to fix it. Like we're not going to fix cavities that don't need to be fixed. But if your child's 4 and they have a significant cavity and we know that tooth's going to be in their mouth until they're 10, you don't want the child to lose that tooth at 5 or 5.5 if we leave it unchecked. And you don't want your kid to have a bunch of teeth pulled out, which is a more negative experience than having a tooth filled. So I think that's important. I think it's good for people to just understand that what we're out to do here is control disease. Dental decay is a disease. Dental decay has consequences. And though they are baby teeth, they have long-term ramifications. And there is a rhyme and reason to why we're doing what we're doing, and it is important. So
yeah, I think those are all great points. I know whenever I do some of our educational videos and things, I always talk about how part of our job here is also to eliminate the future fear of the dentist. Mm-hmm. You know, you also want your child to be able to go off to college, get their job, they get their new dental insurance, they're no longer on your dental insurance. And, you know, if they've had any kind of negativity going into all of that, they're not going to want to continue to go to the dentist, and then they're going to be in the pain management situation that you talked about a little bit earlier. And so I think it's very important to point out some of those things and really, you know, almost teach parents that, like, you know, yeah, you're telling the funny story about what happened when you were a kid at the dental office, and you're like, oh, and he gave me this and he did that, you know, all these things. And if your kid's within earshot of that, they are hearing that and they are taking that on. Now, whether or not the whole group laughed about it or whatever, the kid is still internalizing that. And so I just think it's really important. I know I even sometimes moms will call and they'll be like, what do we do? Like, they're so scared. They've been medically traumatized, like all these things. And I'm like, don't tell them that they're coming to the dentist. Just show up at the building. Like, you don't have to build it up to be this big thing. Now, if they need to be explained things, there's a way to do that, you know, and you're the parent and you know what's best for them. But these are suggestions. You know, some kids need everything explained and then they'll do fine. Some kids don't need to know anything and then they'll be fine. And so I think you have to find that right, you know, balance for your child and you as the parent. But I think overall, like, parents didn't go to a dental office like we have now, like the theming and the environment.
I think maybe one thing I would add to that is that a lot of the stuff that we do can be done a lot more painlessly than you think that it can. And it is not an assumed fact that your child will experience pain during a treatment appointment. My objective every time is that your child will experience no pain. And so I think a lot of people are like, I've got to prime my kid because this is going to hurt. And it might hurt. I mean, you can't completely alleviate the possibility of pain. But for a lot of the stuff that we do, you can get pretty close. And the pain that is perceived it is controlled and it is brief. And so I think again, maybe someone, like a parent, had a root canal and they weren't numb and they suffered for an hour. And they're imagining my kid is going to hurt for an hour. For one thing, we try to keep all of our treatment appointments exceptionally brief. And so, you know, if we're talking like an elementary age kid, I don't want to be working on your child for more than 15 minutes because every kid comes in the room with a timer and you don't know when that timer is going to run out. And so you need to be efficient. And so we all want to be efficient. The longer the child sits there, the higher their anxiety is. So we're trying to be efficient. So that's the first thing. So nothing is going to be drawn out. But then, yeah, the second thing is just that our techniques and our processes, or the way that we do the things we do, is all about mitigation of discomfort. And I think we do a really good job.
I agree with that. All right. Well, I just want to say thank you for taking time out of your busy schedule. I know you have a lot going on, so I really appreciate you coming on. So we're going to sign off for today. We just want to make sure that if you are watching this video, we really appreciate you taking the time to watch, and go ahead and make sure you're following us on all of our social media channels. You can find us on Facebook, Instagram, and YouTube just by searching Smiles Are Wild. We'll see you guys again soon. Thank you.